All right, we are live. Hello, everyone. All of you who are watching it live, and those of you who are going to watch it after the stream, and it's also a very, very warm, whatever time of the day you are watching it. Today, it's an evening, a Saturday evening, and I thank Dr. Manav to be here with us. Dr. Manav Gupta is here with us to share his insights of test taking strategies, how he basically goes about taking the test. So, why are we even doing this series called Think Like a Topper? See, primarily what we have seen among a lot of students is they have seen all the videos, they've seen most of the videos, they've solved a lot of question bank modules also. But when it comes to the GTs, they typically end up attempting GTs in the last 1 or 2 months just before the exam. And they are probably not able to properly strategize during the GT, because of which they may have an औकात score of 550. I mean, 550, 560 mark लाने का औकात they may have in the exam in a NEET PG, but they end up scoring much lower than that because they don't strategize the time limits. They get stuck at some questions in between. They tend to mark a lot of wrong answers because of guesses. So here we bring to you proudly Dr. Manav Gupta. Dr. Manav Gupta is ranked 14 in INI CET. Hello, Dr. Manav. How are you doing?
Good evening, sir. Good evening, sir. I'm fine.
Good evening. So he is ranked 14 in INI CET. That itself is a humongous achievement. But a couple of months ago, a month ago probably, when NEET PG results were announced, Dr. Manav fared very well in that as well. He scored rank 111 in NEET PG. Dr. Manav did his MBBS from MAMC in Delhi, and if you are wondering that he has a lot of practice and he has worked very hard after his MBBS, it's not like that either. He has done it right after his internship. That only indicates one thing, that he has been one of the early risers, and he has started off early, and he has been consistent with the testing as well. Dr. Manav, here I leave the floor to you. Share your insights while you take us through your attempt of the grand test. Share your insights to all your tutors who are looking at it, all your peers who are probably repeating a NEET PG or an INI CET. How is it that a topper thinks? What is it that distinguishes the mindset of a topper than from someone who is probably not able to achieve his or her dreams? So that's what the idea is. Dr. Manav, the floor is all yours. Rakesh, you can put the screen on stage.
Should I just pick a random GT, or you will suggest me one? Hello? Hello, am I audible? Hello? 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 Should I start the GT?
Yes, sir. You are audible.
Hello?
The screen is visible. You can. You are audible. The screen is visible. You can start the GT.
Okay. So hi guys. So I'm just going to start a random GT from DocTutorials app. So yeah. So here's the first question. So at what point in time is the population assessed for the calculation of crude death rate? So as we know, the crude death rate, crude birth rates are like basically statistical indicators, and these are usually calculated during the mid-year. So the denominator in the crude death rate is mid-year population. So mid-year population, the answer would be 1st July for this. Like obviously not 1st January, 31st December, because these are definitely not any mid-year time. And 1st May is also not related anything to mid-year. So it's basically a factual question. Which of the following statements regarding tear film secretion is correct? Aqueous layer is secreted by the goblet cells. Seems right. Aqueous layer is secreted by gland of Mans. I have never heard about Langermans personally. Aqueous layer is secreted by lacrimal glands and glands of Cross and Wolfring. Okay, aqueous layer is secreted by Mobian glands. The final, or the D option is definitely wrong because Mobian gland secretes fatty layer, the lipid layer. So D option is definitely wrong. I'll keep it for mark for review because I know one option is definitely wrong. So in within the three, I'll definitely will will definitely rule out one the two other two of them, and will definitely mark one. So I'll just mark this for the time being, and I'll mark for review. How to mark for review in this? Just a second. How to mark for review in this? Hello, am I audible? Okay, so we'll just come again and we'll see it again. A 76-year-old lady complains for headache for 2 days in the right side of the head. The pain is worse when she is talking or chewing. She also had mild fever. ESR is high. The vision. Okay. So basically, we can see this is a case of giant cell arthritis considering the age. The age is more than 45 years. So basically, there are two things of Takayasu's and giant cell arthritis: headache, raised DSR, and loss of vision in one eye. Typically, shows that this is giant cell arthritis. So for the management of this, basically, we have to start methylprednisolone first and do not wait for the biopsy. So the answer would be A only. So here's a photo of a skin, someone holding a slide against a skin. So basically, hello. Just I'm not able to. View other options. Hello. ये Which of the following nerves pierce the clavipectoral fascia? So basically, it's a fact-based question, and the answer is lateral pectoral nerve. Manjula, 47-year-old woman, presents with hot flashes after menstruation. Hot flashes can be relieved by administration of weight of the following agents. So hot flashes includes postmenopausal syndromes, and for the drug of choice for the postmenopausal syndrome is hormone replacement therapy, and hence the answer is ethylene estradiol. To test the weight of the lung is compared with the body weight. So this is a fact-based question. I actually don't remember the answer. Either the answer is Plockett's or Fodere's. Static test is definitely not this. Redden's test is definitely not this. Either it's Plockett's or it's Fodere. I'll mark Fodere's right now because it's a fact-based question, and I think Fodere's is the answer, but I'll just do it up, for a while, after a while. The other question is, 25 bilateral connective nerve worsen during pregnancy. So bilateral connective hearing loss worsening during pregnancy in a 25-year-old female suggests autosclerosis, and also the progressive nature also suggests autosclerosis. Type of impedance audiometry, autosclerosis. The type of impedance is AS. AS means sclerosed. A 14-year-old girl with patchy hair loss. What is her diagnosis? So alopecia areata. This thing doesn't seem like alopecia areata because it's over the accessible areas of the scalp, and definitely not alopecia areata because it is also not circumscribed. Tinea capitis is definitely not this because we cannot see any scarring or any like inflammatory thing over there. And definitely not female pattern hair loss because 14-year-old will not have a female pattern hair loss, and female pattern hair loss starts from the apex. So the answer is trichotillomania because it's more common in female and results in patchy hair loss over the accessible areas. Census method used in India. So there are two types of census method used in India, de facto and de jure. De facto means that the person personally goes and sees if a person lives there, and de jure means the records are seen. So both of them, as far as I remember, both of them are used. 32-year-old woman presents with her primary care physician with complaints of fatigue, weight gain, and constipation, while she reports feeling cold, dry, and coarse. So 32 32 so 32-year-old woman with fatigue, weight gain, and constipation points towards hypothyroidism. Pale, cool to touch, puffiness, everything points towards hypothyroidism. TSH is raised, thyroxine is low. Most likely diagnosis is simple one, hypothyroidism. Nothing to be scared of from this question. Following ECG with acute onset breathlessness. So as we can see, there is electrical alternance in this GT with high and low voltage complexes present. I don't think it's AFib because the interval is regular, but the complexes are high and low. So for electrical alternance is seen in pericardial effusion. So for pericardial effusion, definitely not chest X-ray, definitely not Holter, definitely no VQ. We'll go for an echo and we'll see if the fluid is accumulated there or not. Chest X-ray can be done, but a much better investigation is echo. Like USG is friend of ultrasound. So that's why Vidal is negative, abdominal distension. Basically, in this question, RK39 positive only points that it's leishmania, and the drug of choice for leishmania is liposomal amphotericin B, nothing else to be seen in the question. To about degenerative myopia can lead to tractional retina detachment, seems right. Less than -6 diopters, not. Short silk retina is seen in hypermetropia. Lattice degenerations are common. Lattice degenerations are not common in degenerative myopia. Can lead to tractional retina detachment, seems right. It's a kind of I have did it based on a rule out thing because lattice degenerations are not common in degenerative myopia. Short silk is seen in hypermetropia, and definitely the vision loss is more than -6 diopters. And can usually the can statements are the correct one. The following is a not a complication, elbow dislocation. Median nerve injury, brachial artery injury, radial nerve injury. So myositis ossificans is not a complication of elbow dislocation. It is a complication of supracondylar fracture humerus. So it's an easy question. Just by ruling out, we can mark myositis ossificans and move on. A 50-year-old woman will define breast for 8 months on examination. Tender non-mass, overlying nipple are normal. So basically, we don't have to read anything in this question. The histopath image shows leaf-like structures present, which are suggestive of phyllodes tumor. Nothing else to be seen in this question. The history is irrelevant. Not irrelevant, but after seeing the histology, you can just connect. Bone limb get intubate, previous ventilator. So in this also, just by seeing the X-ray, we can diagnose the condition. The diaphragm, the intestinal loops have reached the thoracic cavity, and the answer is congenital diaphragmatic hernia. Nothing else to be seen. Student was brought to complain of shortness of breath and was given a prescription for asthma, to which physician suggests that it's very high therapeutic index, which was so very high therapeutic index. High therapeutic index means that the safety range of a drug is very high, so we don't have to do therapeutic drug monitoring for the same. So serum levels will likely to be carefully monitored, no, because it's a high therapeutic index drug. The drug is likely to cross blood-brain barrier. Definitely no, if the drug was to cross blood-brain barrier, it would have a very low therapeutic index because it will then cause adverse effects. The drug is likely to have extensive drug-brain interactions, again no. The drug is unlikely to have any serious side effects, seems true. Complaint doctor, nausea and vomiting. So nausea and vomiting means vestibular nucleus is affected because Edinger-Westphal is involved in IE pathway. Raphe nucleus secretes serotonin, nothing related to vertigo. And lateral geniculate nucleus is involved in hearing, nothing related to vertigo. Vestibular nucleus is the answer. That's it. What is the diagnosis? We can see two ureter going down. Two kind of ureter-like thing going down. So basically, it's a duplex ureteric system. Easy answer, nothing else. Left double ureter is the answer. Left double pelvis. No, it could be this also. Left double pelvis. I have to see. Mark for review. Either it's double pelvis or double ureter. Porter's tip hand. So Porter's tip hand is basically in Erb's paralysis. Nothing which we have to. It's a fact-based question. Basically, it involves adduction, pronation, and flexion of the wrist. So which seems like a Porter. Basically, Porter is the one who has a hand with same position as the one in Erb's paralysis. So the answer here is Erb's paralysis. Which cardiovascular change is not physiological? Mid-split first heart sound, mid-diastolic murmur, shift of apex, decreased peripheral vascular resistance. So as we know, progesterone causes decreased peripheral vascular resistance. This one seems right. Mid-diastolic murmur seems wrong because mostly ejection systolic murmurs are heard in pregnancy due to increased cardiac output. Shift of apex to fourth intercostal space and outward seems right because there is slight cardiomegaly in pregnancy. Split first heart sound is also right. It's a fact-based question. Not exactly fact-based, but you have to remember things like this. Paradoxical undressing is seen in hypothermia because usually we would expect a hypothermic patient to just wear clothes and all, but due to peripheral vasoconstriction, the skin temperature decreases, the thermoregulatory pathways go haywire, and hence the hypothermic patient, in contradiction to what we think, is going to remove all of his clothes. So paradoxical undressing is seen in hypothermia. Which of the following? A 12-year-old boy with recurrent episodes of prophylaxis. 14-year-old boy with male. This is a recent INI as well as NEET question. So 12-year-old boy presents with recurrent episodes of epistaxis and reddish nasal mass. All of this points towards nasopharyngeal angiofibroma, whose investigational choice is CECT. That's it. What are people know? Mycosis. So yeah, the triad of poikiloderma, it includes telangiectasia, skin atrophy, and pigmentary changes. It's a fact-based question. Nothing. Even I don't know the reason behind it. I have done this question earlier, so that's why. Minimal antenatal visits as per MCH is 4. Fact-based question, and ideal are 8. according to Government of India, and 13 to 14 according to WHO. Which question I have? I have answered 20. Okay, nice. Patient presents with swelling and tenderness in the joint extremities, synovial fluid exuded, urate crystal arthritis. Urate crystal points towards gout. Drug was prescribed. Suicidal inhibition. Everything points towards allopurinol. Allopurinol works by the mechanism of suicidal inhibition. This is a fact-based question because it changes to oxypurinol, which further inhibits the conversion of formation of allopurinol. So 40-year-old female presents with symmetrical polyarthritis and also with morning stiffness that gradually resolves over an hour. Symmetrical polyarthritis with morning stiffness that gradually resolves points towards rheumatoid arthritis. NSAIDs improve the symptoms but don't have disease-modifying activity, because we know disease-modifying activity for rheumatoid arthritis are DMARDs. So definitely A is wrong. I'll rule out A, B, and D. So the answer is C only. It's an easy question. There is erosion on X-ray. Again, false. Raised DSR, CRP is there. HLA-DR4 is increased. So C and D is the answer. Okay. So the next question: all the following statements about toxoplasma are true, except oocytes are in freshly passed. I don't remember microbiome. Let's rule out the options. May spread by organ transplantation seems correct because there are bradycyst. I hope I'm pronouncing it right. Bradycysts are present in the organs, which helps in spread of toxoplasmosis. Oocysts in freshly passed cats are infective, seems right. Maternal infections inquired after 6 months has higher risk of transmission, seems wrong. Before 6 months, okay, sorry. Before 6 months, the risk of transmission is high because that's the time done in question after, because the toxoplasma usually I guess spreads during second trimester only, and the effect seen in the fetus is more. And it's just an educated guess. That's it. Muscle is accommodation. So muscles for accommodation. Accommodation includes constriction of pupil. So I guess Edinger-Westphal is the answer because dorsal nucleus and nucleus ceruleus are not related to eye. Pretectal nucleus. Accommodation. Pretectal nucleus is involved in constriction of pupil. Okay, I'll just mark for the confusing between the two things. Anteroposterior clavicle cyclist. So it's a clavicle fracture, as we can see in the mid shaft. If we don't treat it, then what will be a positive, which non-treatment most likely lead to which positive outcome? Higher satisfaction, definitely not. Higher union rates, definitely not. Faster return to activities, low reoperation rates. Higher because clavicle fractures mostly lead to malunion, not non-union. So higher union rates, higher satisfaction, definitely not. Faster return to activity, definitely not. Lower reoperation rate, definitely not. High union rates could be the answer because it leads to malunion, not non-union. So I'm just guessing it. Not exactly the answer of this. 43-year-old woman, fever, myalgia, neck pain, biopsy. So basically, it's a case of subacute thyroiditis, which happens to follow after a viral infection. No, the pain is also there, right? So it's a de Quervain arthritis. Subacute happens after pregnancy, and de Quervain happens after viral because of I don't know the exact reason, but after viral, it's the de Quervain thyroiditis, and after pregnancy, it's subacute thyroiditis due to autoimmune phenomenon. So we need to know all these four arthritis, and after ruling out, the answer is de Quervain arthritis. Thyroiditis. I'm sorry, why I'm saying arthritis. A 2-month-old infant presents rashes in the diaper area. So it's diaper dermatitis. I don't know much about it, but we'll try to give it an educated guess. Frequent diaper changes, increased diaper-free period seems correct. Antifungal treatment is not an answer because antifungal treatment is used in candidal dermatitis. Dermatitis does not require antifungal treatment. CD28 drug. It is a fact-based question. I remember the answer as abatacept because it's a co-stimulator inhibitor and hence prevents the full T cell activation, and hence the answer is abatacept. Nothing to be scared of. It's just a fact-based question which you need to remember. 78-year-old female complained of vertigo, weakness, lower limb. Plethoric face, injectable injection, and overall and dusky cyanotic complexion were observed. Regular rhythm. BP is high, RBC is very high. Not very high, it's high. WBCs are high, platelets are high. Everything is high with vertigo, intermittent weakness, and severe headache. Weakness or right lower limb stroke हो सकता है. Plethoric face, dusky cyanotic seems like polycythemia vera. In this, viscosity of blood is drastically decreased. Plus polycythemia vera because all three blood lineages are increased. BP is high, blood is viscous in this case. So the first question is false. Given place is not CML, it's polycythemia vera. In this, there is infective lesion. No, given case is polycythemia. Seems right. Yes. Okay, what is this? What is this? What is this? It's pubic diastasis, according to me. The pubic bones are very far away. So pubic diastasis is associated with ectopic vesica in which the bladder just comes outside due to the separation of pubic bones. Okay, dorsiflexion. Dorsiflexion. So all the muscles on the anterior side of the leg causes dorsiflexion. So peroneus longus, tibialis anterior. Peroneus longus is on the lateral side, does not cause dorsiflexion. It causes external inversion, the opposite of inversion. Okay. So उसके बाद recurrent spontaneous abortions are seen in torch infection. Torch never causes recurrent spontaneous abortion. It's a thing we should remember. That's it. Fact-based question. Identify the false statement regarding abrasions. Involves superficial layers of skin. Correct. Caused by contact with a surface. Correct. Sharp objects cannot cause it. No. Direct application of force can be determined by examination of the force. Everything is can. Cannot is much bolder statement. So definitely this is not an option. Sharp objects can cause abrasion. Singer underwent thyroid surgery. Her recovery has been satisfactory. Singer higher notes. Higher notes. So basically to increase the note of the voice, we need superior laryngeal nerve because it's the one which supplies the cricothyroid, which helps in increasing the tone of the voice. So, and it's also the most common nerve injured in thyroid surgery. So the answer is superior laryngeal nerve. Okay, serious sunburn after exposure to sun points towards xenoderma pigmentosum, in which the DNA excision repair mechanism, DNA nucleotide excision repair is defective. Bloom leads to leukemia. Neurofibromatosis is not related with sun exposure. Cocaine syndrome is not related with sun exposure. Easy question. And she has not attended ANC. So 37 with no NC. In this, we'll give a dose of TT. Explain to her. The answer is first. It's a previous year question. It has come in INI CET. We will give the TT and explain that it will not protect the newborn and she should take the second dose after 4 weeks even if she delivers in the meantime. Is the correct option. Ideally, we should give both doses within the pregnancy only by the interval of 4 weeks. But if that's not the case, the first option is the guidelines written in the Government of India protocol for preventing neonatal tetanus. A 30-year-old female presents to her physician with muscle weakness and intolerance. Physically examined hepatomegaly, elevadactin and alanine. Hypoglycemia, muscle fatigue, exercise intolerance with elevated lactic and alanine points with hypoglycemia points towards glycogen storage disorder, in which the answer is glucose 6 phosphatase, not G6PD anemia के साथ present करेगा, not hexokinase. Could be hexokinase. Not hexokinase, not PFK anemia के साथ present करेगा. Glucose 6 phosphatase Is von Gueric's disease definitely not the answer? No, elevated lactate also, right? Hepatomegaly, elevated lactate. The answer is G6. I'll leave it for now. Okay, next. Bilateral hemianopia, artery aneurysm. So the answer is anterior communicating artery. It's a fact-based question. Anterior communicating artery presses on the optic chiasm, causing bilateral hemianopia because the optic chiasm is closely related to anterior communicating artery. Okay, next. Next. Okay, so I visited all of them. Okay, fine. So there are three questions. So I'll view the question palette. Order the question palette. Resume the test. Okay, it's fine. I just ask him how to view the question palette. Hello, how should I view the question palette? So the Foderes question one or the so Ploquets or Foderes. My gut says Foderes, but I don't know Ploquets or Foderes. I'll go with Foderes only. I'll say okay. So I'll mark. I remove mark for review, and I'll go to the next one. For the 16th question. This is not double ureter. This is left double pelvis. Double ureter is not the thing. Double pelvis is the thing in which we apply the Wiegert-Meyer's law, and hence is known as ectopic pelvis. And just remove the mark for review. Next, and we'll go the 26th question. Okay. Edinger-Westphal. Mucosal accommodation. Constriction of the pupil. Constriction of the pupil. Edinger-Westphal is involved in the constriction of. Edinger-Westphal is the answer. For 39th. Okay, so let me just apply some muscle weakness. Hexokinase. Lactate and alanine is also increased. This means it's going into the glucose is not utilized. Hypoglycemia. Glycogen is not synthesized. Glucose 6 phosphatase is the answer because glycogen is not used up. Hexokinase is definitely glycogen getting not used up leads to anaerobic glycolysis, which leads to increased lactate and also increased level of G6 glucose 6 phosphate due to absence of glucose 6 phosphatase leads to increased level of lactate. So we have completed all the questions. We'll just review it once. Lateral pectoral nerve, I'm sure it's the correct thing. Italian estradiol is correct. Codere is, not sure. ES is fine. Trichotillomania is fine. Both is fine. Hypothyroidism, eco, liposome aneuploidy can lead myositis ossificans is not a complication. Thyroid tumor, synovial diaphragmatic hernia. TDM question, vestibular nucleus, nerves paralysis, mid-diastolic murmur is not physiological. Hypothermia, CET, skin hypertrophy is not there. Skin atrophy is there. Fact-based question, allopurinol is right. Iris, Kedinger, Westphal. This I guess was my guess. Dequervain is painful, antifungal not used. Abatacept is definitely correct. Polycythemia vera question. Pubic diastasis. Peroneal strongest. Torch never causes recurrent. Sharp objects can cause abrasions. SLN causes increasing. TT. No, that's it. I'm done with the questions. Yeah, I am done with the section. Can I just go and drink water and come back for a few? Okay. So I've completed my section A and I'll be just taking a break to have water. So I'll be back and I'm waiting to get the timer to get over. usually in the exams you'll not get this much time to wait for the section to get over, because in the exam the pressure is different. At home attempting the GTs is a different thing. So like just be prepared that you'll not get enough time for questions during the exam. Okay, otherwise it's fine. We'll try to like spend more time on each question in the next section, and I'll try to explain it little bit more in a better way, and so that the time is also utilized well and it will be helpful for all of those who are watching. So we'll try. 5 minutes more. Hmm. A child from Bihar with encephalopathy with fever shows sheathed microfilaria with two spaced nuclei up to the tail. So I guess which area? Bancrofty. Okay, I don't remember this one. Does this one have two nuclei or Brugia malai have two nuclei? Either one of them. I guess Escherichia bronchiectasis does not have any nuclei, but Brugia malai has two nuclei. That's what I remember. It's known as exotropia. So the first thing to be evaluated in exotropia is the diffraction correction. So auto diffraction with the use of accommodated control. Refraction with fogging method, cycloplegic refraction. Dry retinoscopy is definitely not the answer. Recent onset auto refraction with the use of accommodative control. I don't know. I'll just skip it for right now. Tibial fracture, cast, casualty. His cast was cut, pain on passive flexion, loss of basically it's a that thing. What is that thing? Compartment syndrome due to the tight cast. So initially we need to first measure whether the pressure increased, like basically the presentation entails to the diagnosis of compartment syndrome. So initially we'll measure the compartment pressure, and if it's more than 30, I guess the difference is more than 30, so we'll go ahead with fasciotomy. Fasciotomy, if it was in the option, I would have marked it first, but measuring the compartment, anterior compartment pressure is a better option. Forgetfulness, gradual memory loss, problem in simple maths calculation, develop incontinence, pneumonia, neurotic plaques, neurotic tangles. So this is a case of what? This is a case of neurotic plaques, Alzheimer's disease. The Alzheimer in this, okay. The Alzheimer's disease, the neurotic plaques and tangles are made of A beta protein because of the involvement of A beta and gamma secretase pathway in the normal blood, which happens normally in the body and leads to the development of Alzheimer's disease. The history is also suggestive of Alzheimer's disease because of gradual memory loss, maths calculation, physicospatial deficit, incontinence, and all. And he later died of pneumonia, which is usually the most common cause of death in Alzheimer's. So the A beta is the answer. Thumb sucking is a source of pleasure definitely for children. Yes. So sign of insecurity, it can cause malocclusion is the true answer. It must not be treated vigorously in the first year because up to 4 years of age, thumb sucking is a normal phenomenon. Rest. I didn't look at I didn't give much thought about the rest of the options because the fourth one was definitely wrong. So basically, this question, the last line only suggests what the question is. Among the question least useful for the management of hyperkalemia. Calcium gluconate is used in the management of hyperkalemia because it stabilizes the membrane and hence does not lead to the formation of arrhythmia. Salbutamol is also important in hyperkalemia, and we give initially 4 to 6 puffs for hyperkalemia because this causes intracellular shift of potassium. Insulin also causes intracellular shift of potassium. Maxelf has no role in prevention of hyperkalemia or in treatment of hyperkalemia. Maxelf has role in preeclampsia or eclampsia for that matter. Chronaxy excitability. So the chronaxy is the measure of excitability. Arrange the chronaxy in the correct order from the highest. So we'll have to see which tissue is the most excitable and which is not. So considering from highest to the lowest, highest excitable definitely is the myelinated nerve fiber. I'll skip it for now because it's going to take very long time. So I'll just view it at the last. So the longer questions I tend to view at the last. I'll try to cover the easy ones earlier so that even if a longer questions takes much time, I am able to at least see the easier ones and do the questions. Indication of prostatectomy in BPH. Diverticulum of bladder is an indication. Acute retention, chronic retention causing renal impairment is an indication. Residual urine more than 40 is an indication. Acute retention is not an indication of prostatectomy. In acute retention, we usually put Foley's catheter and relieve the acute retention. I think this is the answer, but I'm not sure. but I'll go with my educated guess because any acute thing does not require surgery for that matter. Protrusion of meninges and spinal cord with dilated central canal from spina bifida, cystic swelling filled with, okay. Occulta is definitely not the answer because we can see the cystic swelling. In occulta, the cystic swelling is not seen. Meningomyelocele is the answer because meninges and spinal cord. Myelocele is not the answer. Syringomyelocele is, I've never heard of syringomyelocele, but meningomyelocele is the answer because meninges and spinal cord both are protruding out. If only meninges, if only spinal cord was protruding, myelocele would have been the answer. Spina bifida occulta would present with a patch of hair with the spine deficit beneath it. So definitely meningomyelocele is the answer. Which is most common congenital? It is a fact-based question, and septate is the answer as far as I remember. It's a fact-based question, nothing logic in it. Death of woman, Kevorkian sign. So Kevorkian sign is basically the I remember the cattle tracking of the retinal vessels is known as Kevorkian sign, and it is usually visible within the less than 1 hour. It is also a fact-based question. Did 30 minutes to 1 hour that thing is visible. Suddenly developed aphonia, immobile cords. Okay. As we can see, the cords are paralyzed in an abducted position. This means the adductors are paralyzed. This means the adductors. Okay. But sudden aphonia, the cords are immobile. It could be functional aphonia, but in that case, the cords will be mobile on laryngoscopy. Phonesthesia does not prevent with sudden voice loss. It presents with voice fatigue. So bilateral adductor palsy is the answer because the vocal cords are not able to adduct but are in an abducted position. By seeing the options, we can already determine that the question is related to bacterial vaginosis. What? The following not a diagnostic criteria. So the criteria for bacterial vaginosis consist of 4 things, which includes the test positivity, vaginal pH less than 4.5 or more than foul smelling, watery discharge, homogeneous is there. Whip test is positive. Clue says vaginal pH, I guess, is more than 4.5. Yes, vaginal pH is more than 4.5, not less than 4.5. I don't remember. But yes, vaginal pH is more than 4.5. Concept of screening search for unrecognized disease is included in the definition of screening undertaken among persons. Just a second. My lamp is not working properly. Undertaken among persons who have early symptom of disease sounds right. Undertaken by means of test which can be rapidly applied. Undertaken to sort out those who probably have the disease from those who probably do not have. Screening is done in asymptomatic persons. So basically, this is not the right answer. Screening is done in asymptomatic person. In symptomatic person, diagnostic tests are done. This is the answer. Patient with history of joint hammer skin epilepsy, Ehlers-Danlos syndrome is the answer. No. What? Yeah, lysyl hydroxylase is the answer because lysyl hydroxylase is involved in synthesis of collagen, and collagen is deficient in Ehlers-Danlos syndrome, and hence the answer is uh, lysyl hydroxylase. Other options, and we'll see the other options also. Aryl sulfatase is involved in I guess something a neurological disease from a Alexander's disease or Canavan disease was the answer. So definitely no neurological presentation. So definitely not aryl sulfatase. Beta glucuronidase is involved in Gaucher's disease. No, Gaucher's disease, I guess. So basically no joint pain, no hepatosplenomegaly. So definitely not Gaucher's. Alpha and acetyl glucosaminidase. I don't know if I've heard it or not, but definitely that's not the answer. Lysyl hydroxylase is involved in synthesis of collagen and hence enadenose is the answer. Okay. Sudden painless loss sounds like transient ischemic attack. Fatigue, jaw muscles while chewing, guess it's transient ischemic attack. She has temporal artery tenderness. Okay, now the diagnosis is changing towards giant cell arthritis. Visual acuity, we already did a question like this in the previous section. Okay, so next best step is schedule an urgent temporal artery biopsy. No, we'll initiate the treatment with steroids. Before biopsy, we'll definitely initiate this treatment with steroids because there is visual loss. In any case of visual loss in giant cell arthritis, always start the treatment of steroids without waiting for the biopsy. Gram stain yeast-like morphology. Yeast-like morphology. Candida tropicalis, Cryptococcus neoformans, Penicillium marfani, Aspergillus fumigatus. All of the following are most likely except. I guess Aspergillus Candida tropicalis is yeast-like, could be yeast-like. Cryptococcus is also is common in HIV. Penicillium marfani is also common in HIV. Aspergillus fumigatus will not show yeast-like morphology, I guess. Go with Aspergillus fumigatus. Don't know. Mass causing pupillary deficit causing most likely. So homonymous hemianopia means the same side of the lesion. Both visual fields are absent. So it usually presents an optic chiasm. In optic nerve, there is left-sided hemianopia, or whatever side optic nerve is gone. Optic tract and occipital lobe leads to heteronymous hemianopia. Optic chiasm leads to homonymous hemianopia because the nasal fibers are crossing, which will cause visual field loss in the same side of the eye. Recurrent backache stiffness. It is a bamboo appearance. I guess it's ankylosing spondylitis. Easy answer. The arrows are pointing towards sclerosis, osteophytes, also male 30-year-old recurrent backache and stiffness leads to Langston. Michaelis-Guttman bodies are calcifications found in malakoplakia. Fact-based question, we can see calcified bodies. Here, recent NEET question, NEET part 2 question. Least common cause of sepsis in neonates. It is a fact, but E. coli and Klebsiella are the most common cause. Group B streptococcus is also most common cause. Enterobacter is not a common cause, not in the list. Spironolactone, okay. Read the whole question. Hypertension, thiazide has been prescribed. You are still having LBP. Include the indeclosion is done. Okay, so basically, spironolactone is a potassium sparing diuretic. So to reduce the K plus loss, we will use spironolactone because thiazide causes hypokalemia and spironolactone is a potassium sparing diuretic. Okay. Okay, what is this? This is suprapubic catheterization. I'm getting a call. I'm sorry. This is suprapubic catheterization. We can see bladder. bladder with, we can see distended bladder, but we have gone through the abdomen only. We have not gone through the urethra. So the answer is suprapubic cystostomy. Lymphatic drainage marked by the pink area. It is a fact-based question. Some mental notes is the answer. Okay. Because this is the mentum, and some mentum leads to this drains here. Spalding sign. I don't remember the exact thing. I guess it was 12 days, 2 weeks. I leave this one as fact-based question. I don't remember this one. The following about extradural hemorrhage is false. Extradural hemorrhage may be ruled out in absence. Nope. Skull fracture always does not, absence of skull fracture does not necessarily mean that EDH is absent. 35 ml is correct. I mean, I don't need to just view at the other options. The first one is definitely wrong. What is this? Which mode of speech? So this is a tracheoesophageal prosthesis. So he'll use tracheoesophageal is the answer. Electrolarynx is the machine. Chicago method I have not heard. In esophagus, no prosthesis is used. In this, we can see it's not a suprabasal split, and also the blisters are painful. So definitely not bullous pemphigoid is not the answer, because it includes the split below epidermis. Pemphigus vulgaris is not the answer because it's suprabasal split. Pemphigus foliaceus is the answer because in this stratum corneum is involved, as far as I remember. Usefulness of screening test is given by screening test. Usefulness is always given by sensitivity. Specificity is related to diagnostic test, not screening test. And when in homocysteine, which of the following condition is likely responsible? It's B12 deficiency anemia, pernicious anemia. B12 deficiency is related with pernicious anemia, which leads to elevated level of serum homocysteine and methylmalonic acid, and hence also leads to subacute combined degeneration due to loss of myelination of the nerve fibers due to accumulated methylmalonic acid. It's a very easy fact-based question. Anemia with tingless numbing fatigue in hands and feet always point to a diagnosis of vitamin B12 deficiency, and hence pernicious anemia. GCS. I always forget how to calculate GCS. Painful stimulus. The I1 was 4 was normal. Therefore 4, 5, 6. I was 4, muscular was 5, and voice was 5, muscular was 6. EVM. 4 was normal. 3 was spontaneous. 4 was normal. 3 was spontaneous opening on I guess not painful. Second was painful. So painful eye opening is seen. Painful stimulus is E2. So we can rule out B and D. Inappropriate words. It was fifth was normal. Fourth was confused. 3 was incomprehensible, inappropriate words. Second was incomprehensible sounds. E2, V3. So the answer is okay. Okay. And withdrawal. Flexure withdrawal was M4, I guess. That's the answer. Leads foot advertised. Slow growing colony. Few microconidia. Trichophyton, microsporum. Okay. In trichophyton, there are lot number of microconidia. In microsporum, there are a few number of microconidia. In epidermophyton, there are no microconidia. Few, I guess, it will be microsporum. This is fact-based question. So, trichophyton has a lot of microconidia. Micro has few, and epidermal has no microconidia. Which congenital has a microspherophakia as wheel Marchesini syndrome? It is a fact-based question. Microspherophakia with lens dislocation. It's a question. Thigh pain, examination in large, deeply soft mass, laboratory elevated ESR, leukocytosis. Leukocytosis, ESR, thigh pain. It is looking like Ewing's. No trauma. So definitely Ewing's. With ESR raised and leukocytosis, definitely Ewing's. Ewing sarcoma is the answer because we can see small round blue cells in histopathology. So, and also the lesion involves the diaphysis. Nothing else do we need to think of. A sudden anuria, diarrhea, abdominal pain, anuria is typical HUS. Platelet count. No, Adam is normal. If Adam was not normal, Adam TS13, then the answer would have been atypical HUS. It's not DIC because DIC does not present like this. TTP is definitely not the answer because Adam TS13 is normal. Atypical HUS is not the answer. Typical HUS is the answer. Ruling out health in this particular question. Okay, so when a patient is on steroid, his immune system is compromised. Hence, we cannot give live vaccines to the patient. So all vaccines can be given no. Only killed can be given yes. Only live can be given no. Defer all not. Only killed vaccines can be given. 67 history of traffic presented with pelvic fracture and trauma, CT scan, there is density, morphine there. Respiratory difficulty. When we give morphine to a person who is a case of raised ICT, morphine also what happens is morphine decreases the respiratory centers and hence the CO2 accumulates and hence the CO2 accumulation further leads to vasodilation in the skull and hence the ICT rises more. So respiratory depression and CO2 retention due to opioid is the answer. Morphine addiction एक डोज से नहीं होता, pelvic fracture से लेना देना नहीं है, CNS lesion तो था ही नहीं आंसर. Gold standard for diagnosis of coronary artery disease is coronary angiography because in this we are directly viewing the artery and the occlusion by injecting the dye. Stress echo, cardiac MR, PET can be used, but coronary angiography is the gold standard. Gold standard means with which you can definitely say that the atherosclerosis is present and hence coronary angiography. Inferior root of ansa cervicalis is a fact-based question. So, I don't remember. I'll just put inferior belly of homohyoid because inferior root, inferior belly of homohyoid. I don't remember the answer. No. Earliest manifestation of end organ damage and chronic hypertension. Again, a fact-based, but my gut says the answer is visual impairment because in the chronic hypertension, it usually leads to visual impairment initially because vision loss, vertigo, and blurring of vision is the initial symptoms in chronic hypertension, and hence we define malignant hypertension by the presence of papilledema. Hepatic renal can be seen, but always late. Pulmonary dysfunction is not particularly seen in that thing. Chronic hypertension. So now we will see what questions we have left. I left second question. Okay. So I'm going to leave this one because I don't know much about diffraction methods. The chronaxion, see the cardiac muscle is definitely not more excited. Smooth muscle are more excitable. Nerves are always more excitable than the muscles. So myelinated nerves, then D, A, D. So this is the answer by ruling out. Definitely not B, not never skeletal muscles are more excitable and definitely not cardiac muscle. So I'm going to put it here. Also, it's a fact-based question, but I think I remember the time period for Spalding sign was 12 days or 2 days. I don't remember, and both are in the options. I'm going to leave this to be on the safer side because we have already done so many guesses this time. So I guess it's better to leave this because leaving questions also determine how much rank you're going to get. So this one also was my educated guess because I remember which area bankruptcy does not have any nuclei, and Bruggia Malai has 2 nuclei. I have left this one. This was measure anterior compartment pressure. Okay. This was A beta, the Alzheimer's one. It was thumb sucking one. Definitely not hit in the aggressively. Maxwell, Donaxi, pure retention, meningomyelocene, septate, less than 1 hour, packed waste, my retina adductor, pH more than 4.5 is the answer. Undertaken ovarian, no symptom is there. It was lysyl hydroxylate, steroids, aspergillus, just a educated guess because I never had aspergillus in HIV. Oxford, molecular introvector, reduced K plus, spiral electron wala question है. Suprapubic cystostomy, C is mental leaving, EDH never absent. Visual prosthesis, fallacious, because it was like just corneal split. Sensitivity screening, pernicious anemia, E2. I don't know. This is also a fact-based question. I don't remember it. Micro and all were my subjects which were most volatile. So that's why. मतलब नहीं याद आ रहा है मुझे. Microspherophakia wheel Marchesani syndrome, E-wings, Adam typical HUS, killed vaccines can be given. Respiratory depression, gold standard was coronary angio. Again, I'm putting an educated guess, inferior root, inferior belly pomoid. This is a fact-based question which you all should know if you're preparing for an exam. Earliest manifestation, visual impairment, again a fact-based question. So that's it. I'll wait for the timer to get over. I'll mute myself. Timer to get over. Starting section C. It's for Mental Health Care Act. A mentally ill patient decide who is going to be his caretaker by. The answer in this case would be advanced directive. Living will does not correlate to the statement. Testamentary capacity decides whether the patient or any person is, if he or she is like giving any statement, whether or not the capacity to testament things, the mental capacity to provide a statement is correct or not. Palliative care definitely does not mean this. Palliative care means if a disease is in its terminal stage and we cannot cure it, so we'll only give supportive treatment to the patient, not the curative treatment. Advanced directive is the answer. CT brain. History with CSOM with neurological manifestation. So as we can see here, a ring enhancing lesion with central hypodensity is there on the temporal area, suggestive of temporal lobe abscess or a ring enhancing lesion. Definitely not extradural abscess, because extradural abscess would have presented here, somewhere here. Or cerebral abscess is the answer. No, not. Temporal lobe abscess is the answer. Cerebral abscess is not. Temporal lobe abscess is the most common complication. Most common intracerebral complication in case of CSM. And the most common site is temporal lobe. Okay. Pigmented macules are there. So probably over the chest. So probably it's a fungal infection. Fungal infection causes hypopigmented macules. Most commonly Malassezia furfur, which causes Malassezia furfur causes tinea versicolor. Yes. So incorrect statement. KOH scraping shows pseudo hyphae. I think KOH scraping shows meat, spaghetti, and meatball. Recurrence is common after complete course is the correct answer because fungal infection usually recur. Scratching with exaggerate scaling is the correct answer. Woodland yellow fluorescence is the correct answer. KOH does not show pseudo hyphae. In this, KOH in case of Candida shows pseudo hyphae. In this, we can see swollen limb, probably unilateral limb, probably a case of Wuchereria filariasis, and hence we are preventing the complications. We have not prevented the disease has happened, and we have not prevented the complication. The complication has also happened, but the adverse effect occurring after the complication, we are trying to manage that by doing skincare and all. So this is disability limitation, also known as tertiary prevention, not specific prevention, not primary prevention, not early diagnosis and treatment. Northern European ancestry, progressive dyspnea. She denies the use of cigarettes. Sister, lung problem. Deficiency of alpha-1 antitrypsin. Dietary deficiency of vitamin C will not cause dyspnea. No use of cigarettes. It's probably a case of obstructive disease. Dyspnea, progressive dyspnea is definitely related to obstructive disease, probably emphysema. Also, family history suggests that it's a deficiency of alpha-1 antitrypsin. Prolyl hydroxylase will lead to collagen deficiency, leading to kind of an Ehlers-Danlos syndrome kind of a spectrum, which we discussed earlier. Elastase deficiency is not included in alpha-1 antitrypsin deficiency syndrome or emphysema. Dietary deficiency of vitamin C will also cause bruising, hemorrhages, etc., not pulmonary symptoms. So the answer is alpha-1 antitrypsin. We only had to see कि progressive dyspnea है, obstructive case है, and family history है. So definitely the answer is alpha-1 antitrypsin. The following likelihood of developing Wells production. So it's a fact-based question. So I guess hemoptysis and cancer had a score of 1.5. We'll have to read the Wells criteria. Signs and symptoms of DVT particularly had 3 points. I remember hemoptysis and cancer, I guess, had 1.5, and immobilization had 1, and immobilization had 1.5. Yes. Hemoptysis and cancer had 1, immobilization had 1.5, heart rate more than 100 had 1.5, and one more 1.5. Signs and symptoms had the highest possibility, and hence just a second, I am pausing the GT. Call is coming. GT दे रहा हूँ, फिर वो करूँ थोड़ी देर में. Okay. Coxsackie A mainly causes all except Coxsackie A causes aseptic meningitis, causes hepatitis, causes herpangina, causes enteritis. I guess herpangina Coxsackie A ही करता है. Conjunctivitis. Hepatitis is, I guess, caused by Coxsackie B. Rest 3, aseptic meningitis, most common causes enterovirus, then which includes Coxsackie. Conjunctivitis is caused by Coxsackie A24. Herpangina is caused by Coxsackie A16. So the answer is herpes herpetitis. Patient presents with localized alopecia, poliosis, depigmented fundus, depigmented limbal. Not herpes simplex. Herpes simplex will not cause alopecia, poliosis. Not HLA27 will have symptoms of back pain and arthritis. VKH is the answer. VKH is an autoimmune phenomenon or an autoimmune disease which leads to alopecia because the antibodies are against melanocytes, poliosis, vitiligo, and depigmented fundus, also known as Seguera sign. VKH is the answer for this particular question. Which injury can result? It's the person is pulling, though the caretaker is pulling the child's hand, and hence a common thing. Definitely not fracture because it's definitely not a trauma mechanism. Definitely not fracture, definitely not fracture, definitely pulled elbow. Pulled elbow means the radius is displaced from its annular ligament, leading to displacement of radial head from the elbow joint, leading to pulled elbow, which is more common in less than 5 years of age, with a caretaker pulling the child from his hand only and not supporting the elbow with the other hand. Fracture, definitely not the answer because it's not a high velocity trauma. HPV के microscopic findings is coilocytes. Direct question. Coilocytes mean perinuclear halo. So perinuclear halo leading to ballooning of the epithelial cells. Malary bodies are seen in alcoholic liver disease. Phe bodies are seen in AML M3. which are inclusion of the primary granules. Owli bodies are seen in CMV. Diffuse quelling. So first of all, we need to know encephalocele will lead to brilliantly transilluminant swelling, which is and definitely it will not be present. Most probably it will not be present since birth. Cephal hematoma will not lead to diffuse swelling. It will lead to localized swelling because it is limited by sutures. Caput can lead to diffuse swelling because it is present above the periosteum and hence can spread across the sutures. Subgaleal hematoma, the child will not be this stable. Subgalean leads to hypotension and shock. So after ruling out the answer, they know that the answer for this question is caput succedaneum. MS had to undergo surgery, pre-anesthetic increased liver enzymes. So for should be preferred. So for CLD or increase for liver dysfunction, we prefer sevoflurane because halothane causes halothane hepatitis, which will further increase the liver enzymes. Xenon is not preferred anesthetic agent because it is very costly and not available easily. Enflurane is also not used in hepatic diseases. It is mostly used in neurological conditions. So, is the answer regarding the full thickness skin graft. Full thickness, correct, except okay, false. Full thickness skin grafts are harvested to incorporate the whole dermis. Sounds about right. Composite graft contains epidermis and only a part of dermis. गलत लग रहा है. Full thickness grafts require careful handling. Sounds right. Composite graft includes major part of dermis. That's why it's known as composite graft. Only a part of dermis is not composite graft. Conus medullaris. So there are two syndromes among which we need to differentiate. One is conus medullaris, other is cauda equina. In conus, we see perianal anesthesia because the center of the spinal cord is involved. Involvement of bowel and bladder is early. Sexual disturbance is present. But the cauda equina syndrome involves the peripheral nerves, which leads to lower motor neuron paralysis of the lower limb, which is more common in case of cauda equina than conus medullaris, because conus involves the spinal cord per se, and cauda equina involves the lower motor neuron nerves. So lower motor paralysis is a feature of conus, but a late feature and not a common feature. So answer is LM paralysis. Proliferative changes. Proliferative changes mean hypertrophied endometrium, which is usually due to estrogen. So we need to give progesterone to stop the proliferation because progesterone is an anti-proliferative agent which mainly acts on endometrium primed by estrogen and leads to breakthrough withdrawal bleeding. So for this, medroxyprogesterone acetate is preferred and is the drug of choice for proliferative endometrium. Yeah, the valid consent cannot be given by age less than 18 years. I think we all should know this because less than 18 years, a person or a girl cannot give consent for sexual intercourse. Above 18 years, a girl can give and below 15 years, even if the girl give the consent or any intercourse is involved with the girl, it is known as statutory rape, and 21 years has nothing to do, 16 years has nothing to do with intercourse and all. Asymptomatic lesion, 2-year-old are also the same lesions. Asymptomatic since 2 months. Daughter, same HPV. We can see umbilicated lesions, right? I guess. Definitely not Coxsackie. Coxsackie causes symptomatic lesions, painful lesions. Herpes simplex will also cause painful lesions. HPV will cause warts, not these kind of lesions. Mollusky pox are implicated lesions which can spread from person to person and are asymptomatic mostly. Mollusky pox is the answer. Oh, this is a previous year question. This is known used to calculate standard deviation and is a formula of standard deviation. If the square root was not there, it would have been a variance. Mean, median has nothing to do with this formula. It is a previous year question. Yes, theater affinity and what affinity? Why? The tens form of hemoglobin is more prevalent. Tens form होगा तो affinity ज़्यादा होगी. हाँ, let's 2-3 BPG. अच्छा. Tough question. I'll leave it for now. The statements are confusing. We'll see afterwards. Myasthenia gravis. In myasthenia gravis. Okay. Oh God. I don't know why I want to mark ciprofloxacin for this. Amitriptyline has anticholinergic action, and in myasthenia gravis, already the cholinergic receptors are less. So amitriptyline being an anticholinergic agent will not give in myasthenia gravis because in myasthenia gravis already the anticholinergic antibodies are present. So amitriptyline is the answer. H1N1 is a type of influenza virus. Influenza type A, B, C. I don't know about this. I'll skip it for now. Identify the stage. We'll skip it for now. Don't know about this. Dysphagia, anemia, ulcerative lesion, urease test positive. Oh, urease test positive, an ulcer sounds to H. pylori, and H. pylori predisposes a person to maltoma, which is mucosal associated lymphocyte T cell tumor, and which leads to formation of small round blue cells with decline. थोड़ा सा definitely not carcinoid, not related to H. pylori. Adenocarcinoma related to H. pylori, but H. pylori is protective for adenocarcinoma. GIST syndrome, GIST will not be associated with H. pylori. Maltoma is the answer. Next question, because H. pylori predisposes a person to maltoma. Neonatal resuscitation, the chest compression to breathing ratio is 3:1. This 30:1. I don't remember this. I guess it's 3:1. This is me, I guess. I am using salbutamol pump very frequently, so I might know about it. Salbutamol causes hand tremors, causes hypokalemia, causes hyperglycemia. Salbutamol, but being a beta agonist, causes tachycardia and not bradycardia. That's the answer. Okay, so this is hood, a penis hood. Due to the hood is on the dorsal side, and hence the answer is hypospadias. If the epispadias was there, the penile opening would have been shifted towards the ventral side. So penile opening being shifted towards the dorsal side with ventral hood. Sorry, the hood is on the ventral side, not the dorsal side. See, I'm not able to understand the ventral or dorsal, but yeah, hypospadias is the answer, not epispadias. Definitely not phimosis or VXO, because there would be constriction of the opening in both BXO and phimosis, and will not present with this hood-like condition or shifting of urinary mucus. Subcentral pneumonia, IMNCI. So for 2 years, the breathing rate was 0 to 2 months 60, 2 to 12 months 50, and 12 months to 5 years was 40. So definitely not fast breathing, only fever and cough. So that means this is, then you notice chest hindering. So this is pneumonia, not severe pneumonia. So we'll give home treatment, not severe pneumonia, pneumonia clinical treatment. Pneumonia clinical treatment will be. If chest hindering was not there, we'll give home treatment. We're in cystadenocarcinoma. Cystadenocarcinoma is a malignant tumor. So I guess post-op radiotherapy would be the answer because the patient is nulliparous. So we don't do hysterectomy. CA125, I don't think we'll have to give radiotherapy in post-op cancer is identified, and radiotherapy is usually given in ovarian tumors. Post-mortem finding. This is lungs with Polto's hemorrhages. It is caused due to rupture of capillaries. Larger than 2 mm, it is known as ecchymosis. I guess it's larger than 3 mm, then it is known as ecchymosis. These spots are not reliable indicators of asphyxia deaths because this can be seen in any other form of deaths as well. Usually seen below the level of constriction. These are usually seen at the level of constriction. So I guess these are caused by rupture of capillaries is the right answer. This is erythema gyrum, erythema gyrum, something like that, because we can see concentric whorls. Definitely, if this is related to lung carcinoma, bladder has no skin manifestations. Pancreas carcinoma leads to migratory thrombophlebitis, which leads to superficial thrombophlebitis, which does not prevent with this condition. As shown in the image, gastric carcinoma leads to lesser Trellard sign, which includes seborrheic keratosis, something like that. So gastric carcinoma is not the answer. Lung carcinoma presents with erythema gyrum repens, which is shown in the image particularly. Gyrum repens, gastric. Notes regarding Indian defense women. 19 to 39 years seems right. 1.625 seems right. 20.9 नहीं था अभी हमें 20.50 kgs weight. I think 65 kgs was the weight. 50 kg weight was no, and the BMI was 20.75. Yes, for males, 20.9 for females. 50 kg weight was not there. Yes, weight was 60 kgs. It's a fact-based question. Nothing can be done about it. Skin cancer presents. This is the previous question in which we saw a kid with skin cancers after getting exposed to skin, and at that time I told you the answer is excision repair enzyme, which is seen in xenoderma pigmentosum. It is a direct fact-based question. We don't need to put much logic into it. See, a patient with left foot pain with left pain near the left great toe sound points towards the diagnosis of gout, because gout usually happens in colder areas, peripheral areas. So gout, but septic arthritis usually involves the knee and the hip joint, not the peripheral areas. So synovial fluid analysis could be the answer. Blood culture is definitely not the answer because our diagnosis is not pointing towards septic arthritis. And serum uric acid levels are not reliable indicator in case of gout because the serum uric acid levels can also be normal in cases of gout. So even if the serum uric acid levels are normal, we cannot rule out the possibility of gout. The swelling of the first metatarsophalangeal joint is also known as podagra sign, which is seen in gout. Therapeutic trial of colchicine is not the answer. Synovial fluid analysis will see if there is negatively birefringent crystals present in the fluid or not, and hence it will confirm the diagnosis of gout. Cox postulate. Cox postulate were 4 और 5, which includes कि अगर आप लोगों ने वो पैथोजन आइसोलेट करा है पर्सन से या नहीं, वो पैथोजन वापस मतलब पर्सन में इंट्रोड्यूस करा तो डिजीज हुआ या नहीं, कल्चर कर पाया या नहीं कर पाया. सो बेसिकली कल्चर इज एन क्राइटेरिया. So lepra bacilli we cannot culture in artificial medium. So hence the answer is lepra bacilli, which is usually cultured in the foot pad of mice. Armadillo, 9-banded armadillo. I'm sorry. Phosphatidylserine, inositol. Basically, phosphatidylserine is the marker for apoptosis. It usually shifts from India or inositol. I guess it was phosphatidylserine only because okay, I'll skip it for now. Omeprazole and clopidogrel interaction is the famous one because both clopidogrel gets activated by CYP2C19 and omeprazole inhibits CYP2C19. So while prescribing omeprazole with clopidogrel, we should be careful because omeprazole can inhibit CYP2C19 and hence can lead to the decreased activation of clopidogrel, which can lead to the bleeding episodes. HTK11 is Peutz-Jeghers. Gardner syndrome, Turcot syndrome is related to HNPCC is related to MSH1, MSH2, MLH1. Cowden is related to P10. HTK11 is related to Peutz-Jeghers syndrome. Direct fact-based question. ALP is elevated in endodermal sinus tumor. It is a fact-based question with internal echoes and internal solid structures. So definitely a malignancy, not a benign tumor. Oh God, ALP is elevated. AFP is elevated in endodermal sinus. Beta H is elevated in choriocarcinoma. Also, CA125 is normal. ALP is only elevated. So only ALP elevated is pointing toward mucinous in teratoma. सॉलिड स्ट्रक्चर्स है ना, तो टेराटोमा में हो सकते हैं सॉलिड स्ट्रक्चर्स. एएफपी नॉर्मल एंडोडर्मल साइनस नहीं है. CA125 is normal, definitely not dish. हाँ, so the answer is malignant teratoma. Solid structures होते हैं malignant teratoma में due to like teeth, hair and all, cartilage and all. ALP is also increased in malignant teratoma. CA125 normal है, so we can rule out dysgerminoma and mucinous cystadenocarcinoma. Endodermal sinus is ruled out by normal AFP. Treatment of snake bite: firm bandage to occlude lymphatics. Incision. Incision is sorry. Incision is never done in treatment of snake bite. Incisions are contraindicated. Occlusion करना होता है, reassure करना होता है. We have to take the person to the hospital as soon as possible. Immobilize करना होता है, जिससे कि spread of toxin is limited. Saint Anthony's fire is due to claviceps purpurea, which is ergot, which leads to peripheral vasoconstriction. इसीलिए ऐसा लगता है कि हाथों में आग लगी हुई है. Hence, we know it is known as Saint Anthony's fire. Cocaine is a opioid, not related to Saint Anthony's fire. उसमें respiratory depression, meiosis, constriction of pupil, convulsions वगैरह होंगे. Abrus precatorius is a plant poison, जिससे कि gastrointestinal problems ज़्यादा होंगी. Clostridium botulinum causes paralysis. Definitely not the answer. We'll save it. So we have to see the 5 questions which we have left. The tense form of hemoglobin is more prevalent. Basically, there are 2 forms of hemoglobin: tense and relaxed. Tense leads to increased release of oxygen, and relaxed form leads to increased uptake of oxygen. So I guess fetus में relaxed form ज़्यादा होगा. There is less 2,3 BPG में भी 2,3 BPG भी ज़्यादा होगा, तो फिर oxygen ज़्यादा release होगा. Fetal hemoglobin binds to 3 BPG, fewer ionic bond. No, it bonds oxygen. So it's right. No, the oxygen bond of fetal hemoglobin is shifted towards left. fetal hemoglobin binds 2,3 with fewer iron. It sounds correct, क्योंकि अगर ज़्यादा कम 2,3 BPG से बाइंड करेगा तो उसकी एफिनिटी ज़्यादा होगी. 2,3 BPG से एफिनिटी कम हो जाती है, ऑक्सीजन कर्व शिफ्ट्स टू लेफ्ट. गलत क्वेश्चन है. देयर इज नॉट लेस BPG, देयर इज मोर BPG, and relaxed form is more prevalent in fetus. 21st question. In case H1N1 is the influenza type A virus, basically I guess, don't know about it. Definitely not. Stage of TB. There are few stages of TB: early arthritis, late arthritis, synovitis. But I guess it's destroyed hip joint. And motor and pestal anomaly सी लग रही है, तो I guess it is stage 4 TB. Going for an anonymous, like, random guess. No idea. Oh, forgotten about this. Neonatal resuscitation protocol. Chest का ratio. Neonatal resuscitation protocol. Chest compression का ratio. We'll think about it later. I guess it was 3:1 only. 15:2, 30:2. Infants के लिए होता है. Neonatal 3:1. Fact-based question. Adults भी 3:1 होता है. 35. Phosphatidylserine is the answer. It is a marker for apoptosis, I guess. Not inositol, definitely. It is a second messenger. Phosphatidylcholine is surfactant. Phosphatidylethanolamine भी नहीं है. Phosphatidylserine is the answer. इसमें क्या होता है? Phosphatidylserine usually present intracellularly, but flip होके extracellularly चला जाता है, which leads to eat me signal, जिससे कि macrophages आ जाते हैं and they eat that particular debris which is present, जिससे कि apoptosis का signal मिलता है. So I guess I am done with this section also. I'll go and have quick break. I need to go to the washroom. Break. BMW rules were first made in the year of, I guess, 1984. That's the answer. It's a fact-based question, but I am not sure about it. I'll leave this one. Patient is on metoprolol and he is given verapamil. Metoprolol, verapamil both causes bradycardia and both causes AV block. So tachycardia is definitely not the answer. Torsades pointis is not caused by any of these drugs. Ventricular tachy, no tachy, never tachy. Brady and or both AV block. Gloves. Gloves either contaminated by blood or not contaminated by blood are always thrown in red bin. Red includes plastic, which we throw plastic coated things or the things which are made of plastic. Yellow is used for microbiological cultures, food terms, animal waste, human waste. Black is used for general human or general home-based waste. Blue is used for implants and all. So the answer here is red. Raw eggs. So basically, raw eggs has avidin. Basically, avidin combined with biotin, and biotin involved in carboxylation. Biotin deficiency of biotin causes dermatitis, alopecia, hair loss, etc. And biotin is involved in carboxylation. But although there are some carboxylations which are not biotin dependent, like gamma carboxylations, etc. So biotin is the answer because egg has avidin, and avidin leads to decreased biotin. Simple question, easy vitamin based question. So, engineer fatigue, sedentary lifestyle, computer exam, the junk food, not eating vegetables. MCV is more. MCV is more. This means megaloblastic anemia. But he is not eating vegetables and fruits. So vegetables and fruits are rich in folate. B12 is rich in junk food. So either the answer is folate or B12 because both causes megaloblastic anemia. Acute blood loss से normocytic anemia होगा, sideroblastic से microcytic anemia होगा. तो B12 और फोलेट, B12 जंक फूड में कॉमन होता है, चिकन एंड ऑल में. फोलेट इज कॉमन इन वेजिटेबल्स, आई गेस. तो फोलेट विल बी द आंसर बिकॉज फोलेट्स आर प्रेजेंट इन प्लांट्स. Polyglutamics are. Irradiation can be used in a bone graft, suture, yes. Bronchoscope, artificial tissue graft. ब्रोंकोस्कोप के लिए रेडिएशन नहीं यूज करते, ऑप्थेल्डिहाइड वगैरह यूज करते हैं ना. ब्रोंकोस्कोप ऑप्थेल्डिहाइड से होता है. Scope of aldehyde, glutaraldehyde. डेफिनेटली नॉट. सूचर में कैटगट सूचर होता है रेडिएशन से. हाँ, कैटगट सूचर रेडिएशन से होता है. बोन ग्राफ्ट, टिश्यू ग्राफ्ट रेडिएशन से होते हैं ग्राफ्ट रेडिएशन से होते हैं बिकॉज दोज आर हीट सेंसिटिव ग्राफ्ट्स. कोल्ड स्टेरिलाइजेशन करनी होती है. ब्रोंकोस्कोप ऑप्थेल्डिहाइड, ग्लूटाल्डिहाइड से केमिकल स्टेरिलाइजेशन करते हैं. टेलटेल साइन. Lipofuscin is a telltale sign of free radical injury because lipofuscin is basically also the sign of aging. एजिंग में हमारा फ्री रेडिकल इंजरी होता है. लिपिड पेरोक्साइड. हीमोसिड्रिन का कोई सेंस नहीं है क्योंकि हीमोसिड्रिन में आयरन एक्यूमुलेशन होता है ज्यादा. मेलानिन इज अ नॉर्मल पिगमेंट प्रेजेंट इनसाइड द बॉडी, डेफिनेटली नॉट अ साइन ऑफ फ्री रेडिकल इंजरी or lipid peroxidation. Homogentic acid is a disorder involving the tyrosine wala pathway. So homogentic acid is also not a sign of telltale injury, but it is sign of metabolic disorder. Uh, so answer is lipofuscin, which is commonly found in the perinuclear area. Lipofuscin अंदर होगा इसका. कहाँ पे है? Okay, so I'll try to go slow now. Most accurate region for description of progestin only. Thromboembolic events. So basically, clotting is increased mainly by the estrogen component, not the progesterone. Dysmenorrhea can be caused by progesterone. Decreased lactation. Yes. Progesterone causes decreased lactation. So, and also the OCPs are contraindicated in breastfeeding. So, lactation. Yes, breakthrough bleeding is caused by estrogen, not progesterone. Dysmenorrhea is also caused mainly by prostaglandins, but OCPs are not stopped because of this. In lactation, OCP is contraindicated to this because progesterone and estrogen causes inhibition of prolactin, which decreases the milk secretion and hence leading to decreased lactation. Yes. रेज्ड आईसीपी में ब्लरिंग ऑफ विजन होगा होगा हेडेक दैट वर्सन ऑफ स्टैंडिंग क्रेनियल और पैल्सी भी होगा पैपिलिडीमा हेडेक वर्सन ऑन स्टैंडिंग नहीं होगा हेडेक दैट इंक्रीजेस ऑन लाइंग डाउन ये होगा हाँ, यहाँ की लाइंग डाउन में वीनस रिटर्न बढ़ेगा परमेबिलिटी बढ़ेगी आईसीपी और बढ़ेगा triad of NPH. Incontinence, gauge disturbance, and ataxia. Cuffing is not included in NPH. Fact-based question. NPH is normal pressure hydrocephalus in which the ventricles are dilated without any increase in without any increase in intracranial pressure. So जब हम LP से प्रेशर में मतलब LP से हम देखेंगे कि प्रेशर बढ़ा है या नहीं LP में नॉर्मल ड्रॉप्स गिरेंगे प्रेशर नहीं बढ़ा होगा बट वेंट्रिकल्स डायलेटेड होंगे normal pressure hydrocephalus. Itching, palms and soles, no evidence of primary lesions. So pemphigoid gestation इसमें primary lesions होंगे. Pruritic, urticarial, papules of pregnancy I've never heard of it. Atopic dermatitis का sense नहीं. Cholestasis of pregnancy में होता क्या है? Estrogen and progesterone से हमारा गॉल ब्लैडर का वो मतलब स्टेसिस हो जाता है जिससे कि बिलीरुबिन पिगमेंट्स में कुछ इशू आता है जिससे कि कॉन्जुगेटेड बिलीरुबिन का वैल्यू बढ़ जाता है जिससे कि स्वेटिंग इचिंग एंड ऑल होता है तो आईसीपी इज द करेक्ट आंसर रूल आउट करके कर सकते थे पेम्पिको जेस्टेशन में इचिंग नहीं होगी होगी बट उसमें प्राइमरी लीजन्स भी होंगे प्रोलिटिक अर्टिकुलर पैप्यूल एंड प्लेक्स में भी लीजन्स होंगे एटोपिक डर्मेटाइटिस प्रेगनेंसी में एसेस प्रीडिस्पोज नहीं होता वन हेल्थ मेल should be for 10,000 fact based question nothing no logic in it urban social activists are proposed to work for 1,000 to 2,500 again a fact which even I don't know if I'm right or not nothing can be done about it आरएफएलपी में बेसिकली हम लोग एंजाइम्स यूज करते हैं डीऑक्सी मोस्ट लाइकली टू बी यूज्ड मास स्पेक्ट्रोमेट्री इज यूज्ड फॉर पीसीआर यूज डीऑक्सी राइबोन्यूक्लियोटाइड्स यूज करेंगे डाई डीऑक्सी न्यूक्लियोटाइड्स डोंट नो व्हाट कर दिया मैंने बस limited cutaneous basically limited cutaneous scleroderma is CREST syndrome anti-la is for systemic sclerosis rola SS systemic sclerosis not for limited cutaneous anti-nuclear is generalized anti-smith is वो SLE anti-nuclear किसी भी autoimmune disorder में positive हो सकती है be it systemic sclerosis be it Sjogren syndrome or any other Smith SLE anti-centromeric is there for CREST syndrome which is limited cutaneous ECG palpitations definitely not ST elevation MI. Primary PCI, this is PSVT because P waves are not visible. Tachycardia is there, only QRS narrow based. PCI हम ST elevation MI में करेंगे तो नहीं है एडिनोसिन कर सकते हैं बीपी स्टेबल है तो डीसी कार्डियो वर्जन नहीं करेंगे डीसी कार्डियो वर्जन इज मेनली डन जब बीपी का इशू होता है बीपी हाइपोटेंशन में पेशेंट आता है तो करेंगे डीसी कार्डियो वर्जन एडिनोसिन हम कर सकते हैं एडिनोसिन इज द ड्रग ऑफ चॉइस बिकॉज एडिनोसिन Because adenosine is given narrow QRS टैकीकार्डिया में फर्स्ट ड्रग होती है अगर बीपी हमारा स्टेबल होता है तो ठीक है एम्यूडोरॉन बीटैक हेलो हेलो आर यू सेइंग समथिंग हेलो हेलो ओके फाइन एम्यूडोरॉन हम नैरो ब्रॉड क्यूआरएस टैकिकार्डिया में देते हैं, नैरो में नहीं देते हैं, बीटैक में देते हैं। एडिनोसिन इज द राइट आंसर। अगर बीपी डिक्रीज होता तो वी वुड हैव गॉन फॉर डीसी कार्डियो वर्जन। Patient presented watery diarrhea, seafood. So Vibrio cholerae also causes watery diarrhea, but it is usually not associated with seafood ingestion. Campylobacter usually causes dysentery, not watery diarrhea. Staph aureus is not usually associated with diarrhea, but within 8 hours. Within 8 hours, we have two organisms, Staph aureus and Bacillus cereus. After 24 hours, and mainly by seafood ingestion, is Vibrio parahemolyticus. कॉलेरे सी फूड से रिलेटेड नहीं होता, कंपाइलोबैक्टर भी पोल्ट्री एंड एग वगैरह से रिलेटेड होता है। नोट द आंसर। कावासाकी सीवियर सेप्सिस, सो वी कैन सी, वी इसमें हम रूल आउट करके देखते हैं ऑप्शंस, ठीक है। डोले बॉडीज इज द आंसर बिकॉज डोले बॉडीज आर एनलार्ज्ड एंडोसोम्स which is usually seen in sepsis and all. Heinz body हमें G6PD deficiency में दिखेगी which is condensed hemoglobin, ठीक है। हाइंस बॉडी G6PD नहीं है, कावासाकी एंड सेप्सिस है। पेपेनहाइमर बॉडीज हमें सिड्रोब्लास्टिक एनीमिया में दिखेंगे जो कि आयरन एक्यूमुलेशन है अराउंड द न्यूक्लियस। माइटोकॉन्ड्रिया में आयरन आ जाता है, जिस पेपेनहाइमर। होवल जोली आर रेमिनेंट्स ऑफ डीएनए जो कि हमें मेनली आफ्टर स्प्लेनेक्टमी में दिखेंगे, थैलेसीमिया में दिखेंगे, थैलेसीमिया में दिखेंगे। डोले बॉडीज इज द राइट आंसर व्हिच हैज एनलार्ज्ड एंडोसोम्स में हमें दिखेगा। सेप्सिस में दिखते हैं। पोस्ट मेनोपॉजल ब्लीडिंग फॉर 3 months, नो एनलार्जमेंट ऑफ यूट्रस। पोस्ट मेनोपॉजल ब्लीडिंग है 3 months से, एनलार्ज्ड यूट्रस नहीं है। सर्विक्स नॉर्मल है, डीएनसी कंसिस्टेंट विद एडिनोकार्सिनोमा। Adenocarcinoma, adenomyosis not usually causes adenocarcinoma. It is a benign disease. Chronic endometritis will cause inflammatory lesions, not adenocarcinoma. HPV भी adenocarcinoma नहीं करेगा। पोस्ट मेनोपॉजल में तो हाइपरप्लेजिया से ज्यादा चांस है एडिनोकार्सिनोमा। HPV is not associated with postmenopausal women, usually associated with women who are sexually active. तो इसका आंसर एंडोमेट्रियल हाइपरप्लेजिया होगा। डायबिटिक ड्रग HbA1c, itching. Itching around mycotic infections means urinary tract infections. Urinary tract infections are usually common in case of canagliflozins because canagliflozins causes SGLT2 inhibition. So SGLT2 inhibit होगा तो ग्लूकोज हमारा यूरिन में निकलेगा। ग्लूकोज यूरिन में निकलेगा तो it will act as a food supply or energy supply for organisms, जिससे क्या होगा, वहां पे ऑर्गेनिजम्स ग्रो करेंगे और उससे हमारे को वल्नरेबल इन्फेक्शन होगी। लिनाग्लिप्टिन मेटफॉर्मिन कार्बोस का साइड इफेक्ट ही नहीं होता है। कार्बोस का कॉन्स्टिपेशन, गैस, ब्लोटिंग वगैरह होता है। लिनाग्लिप्टिन का कुछ पैंक्रेटिस, मेडुलरी थायराइड कैंसर कुछ था। मेटफॉर्मिन का लैक्टिक एसिडोसिस और पीटल डेफिशिएंसी होता है। सो कैनाग्लिप्लोजिन इज द राइट आंसर फॉर दिस क्वेश्चन। डिफरेंट स्पीशीज इज xenograft, allograft होता है सिमिलर स्पीशीज। हेट्रोटोपिक मींस पोजीशन, ऑर्थोटोपिक मींस सेम पोजीशन, हेट्रोटोपिक मींस डिफरेंट पोजीशन। xenograft इज डिफरेंट स्पीशीज। सिंपल फैक्ट बेस्ड क्वेश्चन, डेफिनेशन बेस्ड क्वेश्चन। आर्टरीज डू नॉट सप्लाई टू ब्रेस्ट। इंटरनल मेमोरी करती है, इंटरकोस्टल करती है, एक्सिलरी सबक्लेवियन। सबक्लेवियन तो हैंड की तरफ होगी ना, एक्सिलरी भी करेगी तो थोरैकोइड और पेडिकल। सबक्लेवियन सप्लाइज द हैंड नॉट द ब्रेस्ट। डेफिनेटली रूल आउट करके करा था ये वाला। रिस्क फैक्टर फॉर प्लेसेंटा क्रीटा, multiparity can be, maternal is less than 25. I don't think कोई relation है। previous cesarean is a risk factor for placenta creta. Basically previous cesarean is a major risk factor for placenta creta. मुझे बाकी ऑप्शंस का आइडिया नहीं है, but I definitely know previous cesarean is a risk factor for placenta creta because कार पे placenta can get attached and वहाँ पे वो invade कर सकता है and hence can cause placenta creta. Even if I don't know the other three answers, but I'm sure कि हाँ previous cesarean से होता है, तो I can mark this and I can move on. Best study. Oh, best study for a known unknown no etiological hypothesis. Descriptive epidemiology में केस सीरीज, केस रिपोर्ट होता है, which is not best definitely. इनमें से hierarchy में cross sectional study is also not best, case control is not best, cohort is best क्योंकि cohort में हमें etiology नहीं पता, तो अगर हमें कोई नया disease है उसके में etiological hypothesis जाननी है, cohort is the best I guess. A post-op patient on IV fluids develops lesions in the mouth. Urine analysis indicates an excretion of 15 microgram riboflavin, which is abnormally low. एंगुलर स्टोमेटाइटिस राइबोफ्लेविन B2 मतलब कौन सा एंजाइम डिपेंडेंट है? तो 3 एंजाइम्स थे आइसोसिट्रेट डिहाइड्रोजिनेज जिसमें वो होती है रिडक्टिव कार्बोक्सिलेशन होती है जिसमें B2 वगैरह इन्वॉल्व होता है आइसोसिट्रेट अल्फा कीटोग्लूटरेट डेफिनेटली नॉट सक्सिनेट इसमें GT भी होता है फ्यूमरस सिट्रेट सिंथेसिस में तो किसी हालत में नहीं होता तो रूलिंग आउट आइसोसिट्रेट अल्फा कीटोग्लूटरेट वाले थे इसमें आई गेस नहीं राइबोफ्लेविन इज FD वाला ना हाँ तो इट्स द सक्सिनेट डिहाइड्रोजिनेज द ओनली स्टेप व्हिच इन्वॉल्व्स दिस सिंथेसिस ऑफ FDH द आंसर इज सक्सिनेट ओ गॉड सक्सिनेट डिहाइड्रोजिनेज ठीक है वो आइसोसिट्रेट और उसमें तेरा NADH यूज होता है 110 हाँ क्या था evaluation has not limited chest pain changes with position BP is 110/70 and her heart rate is 76 oscillatory mid-systolic click followed by 2/6 apical systolic murmur there's no change galat passive leg raise makes the click murmur occur earlier अरे याद नहीं है I'm not able to remember this I'll try हुक्म का जो होता है नहीं पैसिव क्लिक makes the click murmur occur leg raising में बढ़ेगा click murmur occur नहीं squat murmur makes the click murmur occur later intermittent गलत है तुक्का हमारा N-acetyl parabenzoquinonamine causes hepatic necrosis. NAPQ is associated with paracetamol poisoning. Paracetamol's byproduct is known as NAPQ, which causes hepatic poisoning, and hence aspirin का no relation with NAPQ, opioids no relation with MAPQ, benzodiazepine is no relation with MAPQ. Paracetamol has a relation with NAPQ. Answer is PCM only. NAPQ से होता है तो CYP2E1 से NAPQ बनता है तो हम नहीं देते अभी पढ़ा था 6-7 आवर्स में पॉइजनिंग करता है स्टाफ और डायरियल टाइप बैसिलस सीरियस नेवर कॉजेस 6 to 7 आवर्स में इकोलाई भी कर सकता है क्लोस्ट्रीडियम भी कर सकता है डायरियल टाइप नहीं होगा वॉमिटिंग टाइप होगा हमेशा लेस देन 8 आवर्स में वॉमिटिंग टाइप आता है डायरियल टाइप नहीं आता डायरियल टाइप यूजुअली अकर्स आफ्टर 8 आवर्स वॉमिटिंग टाइप बैसिलस क्योंकि वो वेगल स्टिमुलेट करता है ACH को स्टिमुलेट करता है ट्रांसटूजुमाब रेजिस्टेंट में लापार्टिनिब है वेमुराफिनिब ब्राफ इनहिबिटर होता है मेलानोमा में नहीं BCC में यूज करते हैं सोराफिनिब HCC में यूज करते हैं अर्लोटिनिब लंग कैंसर में यूज करते हैं लापार्टिनिब इज टायरोसिन काइनेज इनहिबिटर आई गेस क्या था हाँ व्हिच इज यूज्ड फॉर दिस इज PYQ क्वेश्चन आई मीन ट्रांसटूजुमाब रेजिस्टेंट मेटास्टैटिक HER2 पॉजिटिव कैंसर्स कॉजेस लापार्टिनिब आयोडीन रिप्लीट में आयोडीन पूरा है सुपरेटिव सबएक्यूट lymphocytic CLL Hashimoto's is the answer iodine depleted area में colloid goiter is the most common cause but iodine replete में Hashimoto's has another name for chronic lymphocytic subacute सबएक्यूट हमारा प्रेगनेंसी के बाद होता है not so common renal is usually associated with fibrosis and all not very common suppurative is infectious not very common develop parathyroid पैराथायरॉइड है फोर्थ से थर्ड से फर्स्ट सेकंड तो डेफिनेटली नहीं है थर्ड से और फोर्थ से दोनों से आता है थर्ड से इंफीरियर पैराथायरॉइड आता है फोर्थ से सुपीरियर फिफ्थ पाउच से कुछ नहीं आता है फर्स्ट पाउच सेकंड पाउच फर्स्ट पाउच से हमारा मिड ईयर वाला सब आता है सेकंड पाउच से टॉन्सिल्स आता है थर्ड एंड फोर्थ से हमारा पैराथायरॉइड आता है द आंसर इज पैराथायरॉइड इजी क्वेश्चन GDM की इनिशियल मैनेजमेंट इज लाइफस्टाइल विद डाइट एंड एक्सरसाइज ऑब्जर्व नहीं कर सकते हैं शुगर इंक्रीज हो जाएगा ऑब्जर्व डेफिनेटली नहीं इंसुलिन सिरप हम प्री जेस्टेशनल डायबिटीज में देते हैं या फिर जब शुगर 200 से ऊपर होता है इनिशियली ओएचए भी नहीं देते, हमेशा लाइफस्टाइल मॉडिफिकेशन करते हैं। ओएचए हम तब देते हैं जब लाइफस्टाइल मॉडिफिकेशन फेल्स। आफ्टर 2 or 3 weeks लाइफस्टाइल मॉडिफिकेशन फेल हो जाती है तो हम ओएचए देते हैं। Okay, so I need pen and paper for this. 5,000 population है, 50 cholera, 10 died, 10 deaths are there. Crude death rate, डेथ रेट का फॉर्मूला होता है टोटल डेथ्स, कैलकुलेटेड डेथ रेट, नथिंग मेंशन्ड. 50 डेथ्स आर देयर, 10 died और 5,000 population into 100. कट. इट इज 1/1000 बिकॉज इसमें हमें कोई केस रिलेटेड डेथ रेट नहीं पूछा, जनरली डेथ रेट पूछा. तो न्यूमेरिकल हमारा होगा टोटल डेथ्स अपॉन टोटल पॉपुलेशन इनटू 1000. तो आंसर इज 1/1000 एयर. कितने मरे हैं? 10, 50 मरे हैं ना? नो. ओके. ओ शिट, मैंने कैलकुलेशन कर दी. ठीक तो करिए, 1/1000 ही तो है. 10/1000 की डेथ हुई. कैलकुलेशन 10/1000. Unconscious emergency medical services 5 response finding unresponsive where he was running a generator due to power outage caused by a recent storm. Cyanotic cherry red. Cherry red is cyanide. Cyanide causes inhibition of cytochrome oxidase. Direct question. चेरी रेड है मतलब जनरेटर में मर गया. यूजुअली साइनाइड पॉइजनिंग हैपेंस इन अ क्लोज्ड रूम जहाँ पे कोई जनरेटर टाइप कुछ पावर आउटेज होती है, लीकेज वीकेज हो जाती है. साइनाइड पॉइजनिंग वहाँ होती है व्हिच कॉजेस साइनोसिस. चेरी रेड डिस्कलरेशन. एबीजी में कार्बोक्सी हीमोग्लोबिन. ओह, इट इज सीओ पॉइजनिंग. ओह गॉड, नॉट साइनाइड. कार्बन मोनोऑक्साइड आल्सो इनहिबिट्स साइटोक्रोम ऑक्सीडेज. साइनाइड नहीं है, कार्बन मोनोऑक्साइड है. साइनाइड में ब्रिक रेड होगा, सॉरी. ऑक्सीडेटिव इंड्यूस का कोई सेंस नहीं है. डायरेक्ट न्यूरोनल टॉक्सिसिटी, ऑल्टरेशन ऑफ मेम्ब्रेन परमेबिलिटी इज नॉट seen. It's definitely not seen. An 80-year-old male patient presented with complaints of exertional dyspnea, chest pain and syncope. On examination, pulse 86 है, BP इतना है, apex paradoxic. Mid systolic क्या हो गया ये? Exertional dyspnea, chest pain, syncope. Paradoxical splitting है, mid systolic murmur है. Paradoxical laterally shift हो गया था ना, hypertrophy. Paradoxical splitting मतलब usually aorta comes early but aortic late आ रही है due to stenosis. Mid systolic murmur भी है. Aortic stenosis में A sound late आएगी जिससे कि syncope. AHD is a triad of aortic stenosis, angina, syncope, dyspnea. ठीक है, तो aortic stenosis is the answer. बेंजीन, इट इज अ PYQ. बेंजीन में फटीग इन्फेक्शन होता है. बेंजीन बेसिकली प्रीडिस्पोजेस टू ब्लड कैंसर, जिससे कि लिम्फोसाइट्स कम हो गए, आरबीसीज कम हो गए. तो आरबीसीज कम होगा तो फटीग होगा, इन्फेक्शन कम होगा तो वो होगा ब्लड, वो ल्यूकोसाइट्स कम होंगे, ब्लड कैंसर होगा. अगर बेंजीडीन होता तो ब्लैडर, डीन ब्लैडर, बेंजीन ब्लड, बेंजीडीन इज ब्लैडर कैंसर. Right-sided valve, IV drug abuser, endocarditis. Most common cause is Staphylococcus aureus. Fact-based question. You should know most common cause of endocarditis. 3-4 होते हैं. लेफ्ट साइड में एंट्रोकोकस होता है, राइट साइड में होता है अक्यूट में स्टैब होता है, सब अक्यूट में स्ट्रेप होता है. So canagliflozin is one drug which is approved with empagliflozin. Canagliflozin, empa DAPA होता है. Canagliflozin is the one, I guess. DAPA, DAPA. I'll go with DAPA. There are empagliflozin and dapagliflozin जो हार्ट फेलियर में यूज करते हैं, जिनकी रिसर्च हुई है. Canna and DAPA थे Canna नहीं EMPA and DAPA थे EMPA एक was a trial इस जो चल रहा था EMPA ग्लिफ्लोजिन का DAPA था Pneumopapilloma head and cancers head and neck cancer में 6, 11, 16, 18 दोनों ही होते हैं 6, 11 I'll go with head and neck cancers I guess 16 is the answer is most common most specific is 18 most common 6 head and neck cancer I'll go with HPV 6 and 11 दोनों ही होते हैं I'll go with this पता नहीं आता हाइपोथर्मिया इज अ क्राइटेरिया कोगुलोपैथी सीरम लैक्टेट यूरिन आउटपुट लेस देन 1 इज अ क्राइटेरिया डीसीएस में जब हमारा पेशेंट इज नॉट फिजियोलॉजिकली स्टेबल तो वी ओनली क्योर द थिंग्स व्हिच इज किलिंग द पेशेंट एंड नॉट कंप्लीटली क्योरिंग द पेशेंट तो हाइपोथर्मिया होता है कोगुलोपैथी होती है सीरम लैक्टेट मोर देन 5 इज अ क्राइटेरिया एंड यूरिन आउटपुट लेस देन 1 ml per kg per hour is the criteria this one I should leave I guess काफी ज्यादा ही तुक्का है ये क्लियर रिस्पांस एंड आई लीव दिस and then see कौन सा बचा है first question I'm also leaving this is a purely fact based question you should not approach this definitely you should not approach this so I'm done hello yes So for most of the questions, for the factual questions, you need to have the factual information with you. Okay. So for that, you need to read your notes again and again and again and again. For conceptual questions, even if you know three statements are wrong and even if you don't know the final one is right or not, you can just mark the final one, because if you know the three statements are wrong, then it's fine. In the except wala questions, what you can do is even if you know one statement is wrong, you can definitely go and check. You don't need to go again with the other statements, even if you don't know them. If you know the one statement is wrong, you can just mark it and move on to the next questions. But most of the questions, they have a clue with them. So if you read one or two lines within it, like in the question which is on the board right now, the canaglyph flows in one. Vulvovaginal area suspected mycotic infections. Sida, the answer is canaglyph, and you don't need to think about any other. That. Exposure of female fetus to androgen in early embryogenesis may arrest the differentiation of. So androgen basically leads to inhibition of differentiation of Mullerian ducts, because Mullerian ducts in presence of testosterone androgens may uh, may not develop. Paramesonephric ducts are basically, or the Wolffian ducts, not mesonephric ducts are basically the ducts which develop into male genital system, so that cannot be the answer. Urogenital sinus is present in both male and female, so that cannot be answer. And ovary is not related to testosterone development or something like that, I guess. Ulivorous fetus continues persistent late. So there are three types of deceleration: early, variable, late. Variable is seen in cord prolapse, UPI. In uteroplacental insufficiency, late deceleration is seen. If persistent late deceleration is seen, no amnio infusion can be done. Oxytocin augmentation cannot be done. This means the fetus is in distress. So I guess we'll need to go for emergency cesarean section. In that case, mono what position change can be done? Yes. Next step could be maternal position change, because first we do the maternal position change, give the oxygen, and then go with maternal. The immediate next step is maternal position change. Normal lifespan of mosquito is 8 to 34 days. That's basically a fact-based question. Abdominal pain, nausea, vomiting. She reported that the symptoms started suddenly yesterday evening and have been progressively worsening. Uncomfortable and writhing in pain. Diffuse tenderness, guarding, neurological. The hallmark. Okay. Gamma porphyrin straight case of or AIP. The other options are not very good. So straight case of AIP. Nothing else. Trali caused by the transfusion of. It can be caused by the transfusion of, definitely by plasma, definitely by red cell, not sure with platelets, but I guess all of the above would be the answer. More somnolent. ALS is brought to the OPD, more somnolent. They repeat problem morning headaches and does not feel refreshed. ABG has CO2 retention, acidosis, and high pickup. So it is pH is low. It's low. 7.4 is normal. pH is low. Acidosis. PaCO2 is a respiratory acidosis with metabolic compensatory metabolic, because HCO3 is normal 24. Compensatory metabolic alkalosis is the answer. It's discharge from penis. Sample was taken. And sent to lab on examination. Gram negative best culture. So basically, Neisseria gonorrhoeae. TCA medium is for Salmonella shigella. LJ medium is used for TB. Bacillus McConkey is used for uh, gram-negative anaerobes, not anaerobes, that E. coli enol group, Bacillus group. McConkey, Thayer Martin is used for Neisseria gonorrhoeae and meningitis. Neisseria gonorrhoeae was the answer. Pregnant female with history of lepromatous leprosy with ongoing treatment with anti-leprotic drug. Okay, so if there is type 2 reaction, we give corticosteroids initially. We never stop MDT because leprosy may flare up and then start here. No antibiotics are required, but it's not infective disease. Thalidomide is a second line drug. We always add corticosteroids first and never stop MDT. Developing of surgical site infection, hypercholesterolemia can cause. Recent operation will not cause surgical site infection. Surgical post-op anemia can cause because host defense mechanism will be less. Recent operation, because surgical site infection usually happens after 7-8 days or more than that. Obesity can cause hypercholesterolemia as a risk factor. Everything causes decreased immune response to a particular antigen. So recent operation, I guess, is the answer. Disaster impact सबसे पहले होगा, तो definitely not CND. Impact के बाद first we'll have the response, not mitigate. Mitigate हम impact से पहले करेंगे, so that the destruction caused by the impact is much less. So impact, response, rehab and mitigate. Impact आएगा, we'll respond to it, we'll rehab the population, then we'll mitigate कि अगर next impact आया तो the disaster is not as much as severe as it was earlier. Which type of diabetes is most likely? Because this is a long stem question, and first read the end line. Which type of diabetes insipidus is most likely affecting this question? What is the underlying mechanism? 45-year-old endocrinic polyuria. We reported patient medical history is significant for pituitary tumor, which was surgically removed. मतलब ADH secrete नहीं हो रहा. Recent head trauma. Physical laboratory low specific urine gravity and osmolarity was serum sodium. ठीक है, तो दिस इज नॉट नेफ्रोजेनिक, नॉट जेस्टेशनल, इट इज सेंट्रल, क्योंकि पिट्यूटरी निकाल दिया था. देयर इज नो वेसोप्रेसिन सिक्रीशन लेफ्ट, which will lead to diabetes insipidus. Nephrogenic में the vasopressin levels are normal. The defect is at the kidney, not the brain. Gestational diabetes pregnancy is related, not related. Primary polydipsia, also the vasopressin levels are normal. So RK39 positive, same question came in the earlier section also. Sickle cell hydroxyurea is no given. Beblotivimab, Vimab, we see VI is coming. It is an antiviral drug. L-glutamine is approved. L-glutamine is approved. Voxelotor is approved. Beblotivimab is the answer. Vimab, viral antibody. Kit 1, cervical scrotal urethra. Lower abdominal pain के लिए kit 6 होती है. Bad direct fact based question. I think we need to remember all the kits for the exam. It's the most common agent associated with agranulocytosis. Steroids, alkylating agents can cause agranulocytosis because they attack the rapidly dividing cells, which includes the bone marrow, and hence they can cause agranulocytosis. Breast steroid, I don't think, mainly they cause lymphopenia. PCM का कोई relation नहीं है, endotoxin has no relation with it. Okay, we have an image-based question. Surgeon's note. This is not surgeon's note. This is Reeve note. This is a Reeve note. This is also same. Oh. Okay. This is a surgeon's note with 1 throw and 2-3 continuous throws. This is 2.5 knot. Okay, fact-based question. For WHO formation day 7th April. Fact-based question, nothing can be done. 7th April 1948. Transport of ADP and inside an ATP outside of mitochondrion is inhibited by rotenone inhibits complex 2, I guess. Cyanide inhibits complex 4. Barbiturate inhibits complex 1. Atractyloside inhibits the transporter. It is a fact-based question. Nothing can be done to understand the logic. MELD score, albumin is not included. Rest, nahi. Bilirubin is included. Creatine, PT, INR. Albumin, I guess, is included in MELD score, not MELD score. Patient has both crush after admission and restless. And both legs are swollen, femur, urine analysis, massive hemoglobinuria. Thighs are swollen, femurs are fractured. BP is normal, heart rate is normal, restless है. Complaining of pain in both the legs, crush syndrome. We'll not do the ultrasound because this is not an urgent indication of ultrasound in this case. Hemoglobinuria, we can consider blood transfusion, but the BP is normal. Normal saline with sodium bicarb should be done because no furosemide, because chest X-ray is normal, no pulmonary edema is there. Bicarb should be given because hemoglobinuria bicarb देते हैं. And blood transfusion we can do. Yeah, but I guess initially the fluid replacement should be by normal saline CBC करा के anemia अगर आ रहा होगा तो blood transfusion देंगे. But I guess blood products are the best to replace. No, I go with normal saline. TSH previous year question ही thionamide से hypothyroidism होता है because it is a thionamide drug. Thionamide drug acts on thyroid gland and hence they inhibit the formation or secretion of TSH. तो thionamide inhibits like thionamide drugs होते हैं ना, carbamazole, methimazole भी कहा thionamide drugs हैं. Ethanamide is like one of them, those that kind. So उससे भी ये होगा. Behavior or social material to is known as plasticity. Fact-based question, definition-based question. Purpose of planning. We'll have to match the limited resource with many problems. To eliminate wasteful expenditure to develop best course of the action. All of the statement sounds right. इसमें आप लोग पढ़ सकते हो, can read all of the statement sounds right, all of the above the option. Basic English based question. A patient lung mass with hypercalcemia. Squamous cell cancer causes hypercalcemia due to PTHRP gene product related, which is act like PTH and hence cause hypercalcemia. SCC से SIEDH and all होगा. Adenocarcinoma से रोजियो सिंड्रोम होता है. SCC से SIEDH होता है. लार्ज सेल से गायनेकोमेस्टिया होता है. Chronic smoker, in right arm there is evidence of chostosis. Pan coast tumor. Pan basically chronic smoker है. Smoker causes apex पे tumor है. Pan coast tumor है. Not pulmonary aspergilloma, not related with smoking, not pneumonia because we cannot see air bronchogram sign. Completely opaque opacity है. SVC obstruction भी नहीं है. Other SVC obstruction the presentation would have been different. It would have been pulsatile, a GVP increased, not this. Pan coast tumor presses on the sympathetic chain and hence leads to ptosis. Pan coast tumor also is associated with smoking. Refeeding syndrome basically happens when after a prolonged total, like a patient is on peripheral feeding and he starts oral feeding, or even if it's a case of malnutrition syndrome and it starts eating again, oral feeding again, it can lead to hypophosphatemia, hypocalcemia, hypomagnesemia. There would be hypercalcemia, I guess. हाइपोफॉस्फेट होगा तो कैल्शियम बढ़ेगा. फॉस्फेट ज्यादा होता है तो कैल्शियम कम होता है. फॉस्फेट इंक्रीजेस देन कैल्शियम डिक्रीजेस. इफ द फॉस्फेट इज लो द कैल्शियम विल आल्सो rise. Phosphate and calcium go opposite. I am definitely sure with. Okay, laminar flow. It is a fact-based question, but I am remembering 2-3 minutes. But I'll leave this. I should not take this much risk. This is a number 11 grade fact-based question. Number 22 has broad belly. 15 is not the answer. Most common type of MODI is MODI type 3 or 2, I guess. 3 is the answer, yes. Fact-based question. Remifentanil is ideal for TIVA because it is highly lipid soluble, It is metabolized by non-specific esterases, hence हम उसको बोलते हैं कि shortest acting है. Hence it is the shortest acting because it is metabolized by esterases and hence it is can be used for total intravenous anesthesia. Seven-year-old with a history of diabetes and hypertension presents to the hospital with new orthopnea. His blood pressure is this and his heart rate is this. He has clear lungs, a displaced cardiac apex without outcome no cardiac. Oh, such a big question. I think I'll read it slowly. A 57-year-old with a history of diabetes, mellitus, and hypertension presents to the hospital with new orthopnea. Okay, his BP is low, kind of normal, low to normal. Heart rate is normal. Clear lungs, so no pulmonary edema. Displaced cardiac apex with third heart sound. So there is overload with no extremity edema. Laboratory test hemoglobin is normal, sodium is normal, potassium normal, creat normal, chest or pulmonary congestion with cardiomegaly. ECG shows sinus rhythm, non-specific STD change in frequent premature ventricular echo shows left ventricular ejection of 20% and dilated left ventricle. Okay. Will not do Holter monitoring because ECG is there is showing only non-specific STD changes and normal sinus rhythm. I think it's a case of heart failure, so we'll go with not with coronary angiography because it's showing non-specific STD changes. Hypertension, heart failure. I guess we should go with not biopsy directly. We should do stress testing to see if the heart is failing or not. It's just a rule out based question. So delivered tearfulness, sleepiness, anhedonia, suicidal tendency is there, so it's psychosis. If no suicidal tendency was there, it's depression. If no anhedonia was there, it was blues. So it's definitely psychosis. Also, she is saying that his baby is not the real one; it's someone else's. So, a 63-year-old woman presents with emergency room with confusion and headache. Blood pressure is found to be this high. Physical examination, skin thickening, telangiectasia, decreased oral aperture. It is systemic sclerosis and ileal management, confusion, headache. It is systemic sclerosis, and I guess creat is also raised. We'll give captopril. Eculizumab is not used for heparin is not used. Amlodipine is not used for initial rise of BP for acute rise of BP and systemic sclerosis. Kidney dysfunction is there, so captopril is preferred because ACE inhibitors are preferred when there is CKD. Eculizumab is used for hereditary angioedema, not used here. Heparin is definitely not used here. Note करके it's simple. This is target sign. Even without looking at the question, I can see it's target sign. Target sign is in an interception only. Direct question. Broadcast are seen in CKD. Acute tubular shows brown casts. Nephrotic has no cast. Glomerulonephritis has RBC cast. CKD is the answer. Broadcast because tubules got dilated. Acute abdominal liver failure is received cephalosporin. Hepatic failure, so there are few cephalosporins approved for hepatic failure. One of them is cefoperazone. Cefuroxime, ceftazidime, and cefotaxime are metabolized mainly by hepatic. Cefoperazone is 50% hepatic, 50% renal, and hence the answer is cefoperazone. Renal stones, urease producing, direct true-white stone. INI question, pH increases, true-white stone are predisposed in urease producing organism because the urine is alkaline there. 43-year-old male patients come to you for follow-up with apprehension of passing brown color. He was very antimicrobial. Brown color urine after antimicrobial is a side effect of nitrofurantoin, not of naproxen, not of GATI, but of nitrofurantoin. Direct question. Reddish brown discoloration when status. So status leads to rhabdomyolysis, which leads to brown coloration of urine. Intravascular hemolysis will lead to brown coloration of urine, but not associated with that. As extravascular will never lead to brownish discoloration of urine. And, and also it is not associated with status. Acute interstitial nephritis will not lead to brown discoloration of urine. In case of blood loss, ideal fluid replacement is zero point 0.9. Ideal is blood product. Most commonly used 0.9% saline. So I guess I'm over with it, and I only left one question, which is an exactly fact-based question. So I guess it's not good to attempt this one. We have to leave some questions. Like I also have guessed many questions earlier, only educational guesses mostly. So leaving fact-based question is good because even leaving questions will fetch you marks. Instead of getting them wrong, it's good to leave them, and hence it can improve your rank also. So as you all must have noticed, ki most of the questions are like there in your notes. So first of all, to do good in GTs, you need to read your main notes thoroughly, at least 2-3 times before your final exam. And the questions which are not like you are not familiar with, either you can leave them, like I did with some few fact-based questions, or you can make an educated guess. Educated guess means not just blindly guessing the option, but like ruling out two options and then guessing between the two options, or like from one or two keywords, you can find which option is right and you can go for that only. Also, for the fact-based questions, you need to read your notes again and again. You will do fact-based questions wrong once, twice, thrice, but till the day of final exam, you should be practiced enough कि आप fact-based questions गलत नहीं करो. For conceptual questions, go for your notes. For maths questions, especially in PSM and pharma, practice them. Practice each and every formula and questions of them at least 2 to 3 times, and definitely will get a hang of it. Do PYQs. Most of the questions, even in your GTs, are PYQs, which is a good thing because in the main exam also the PYQs are repeated. So like there are 2-3 kind of mistakes which students usually make. Recall error. Recall error means you have done the question earlier, but now you are not able to recall. So for that, like there will be 4-5 questions we will not be able to recall from your notes or from the questions which we have done earlier. For that, you don't have to feel bad. You just have to read your notes again, read that topic again, and make sure next time you don't just get it wrong. For the new information thing, it's a new for everyone. If it's in your notes and you're not able to remember it, that's not new information, that's your recall error. New information means that it's not in your notes, you have never done an MCQ regarding it. So it's a new thing for everyone. You can either make an educated guess and you can just blindly guess 1 or 2 questions in the exams. You may get the question right, you may get the question wrong. Even if you get half of the questions right, you will definitely not go in negative. If not positive, definitely not in the negative. New info questions, nothing can be done about it. You just have to practice more MCQs, do more GTs, and you will get better at it. And there are some questions on a silly mistake. Silly mistakes is the major rank deciding thing, even in INI. For me also, for NEET PG also. Try to reduce your silly mistakes to maximum 4, 3, 4, 5 questions. That's it. Even if the silly mistakes are less than this, 2-3 questions, then your rank will be definitely in top 50 for sure, top 100 to 50 for sure. Try to minimize silly mistakes as much as possible because that's what gonna decide your rank.